Hello, good afternoon, good evening, good morning and welcome. Thanks for watching our earwax removal video today. My name's Richard, I'm a registered nurse. I have a clinic in the UK which is called No More Earwax. 2 ears for you today, both quite different. The first one, this young lady came to see me and she has, I don't know if you saw it whilst we were on the way into the ear. You will see it at different points just outside the entrance to the ear. She had quite bad psoriasis. Now, I'm not a dermatologist, but I know a little bit about psoriasis, and it's probably not helped with the contribution to this. You can see how dark and black this plug is in this lady's ear. Now, in psoriasis, like I said, I'm no expert. Feel free to correct me if there's anybody who knows a lot more about it than I do. It's to do with a production or overproduction of skin cells. Quite common areas to get it. Affects a lot of people, and it can be quite debilitating and difficult to treat. Elbows, knees, back, quite a common place to get it. It's not unheard of to get it in and around the entrance to the ear and the ear canal itself. It can be terribly itchy and cause a lot of problems. The skin cells tend to regenerate in a number of short weeks. In psoriasis, I believe it's to do with the immune system, or they think it is. That is a lot quicker. The skin cells regenerate in a matter of days, leading to an overproduction, which can lead to, they call them plaques. And you'll see they're like kind of dry, scaly patches that you see. Like I said, very difficult to treat. You know, daily ointments, moisturising, and in flare-ups. Some steroids can be useful, but obviously overuse of steroids can come with their own problems, you know. But yeah, it's tricky to deal with. In this particular lady, I think there might well be a bit of both going on, where it's got an overproduction of earwax, but it does look like there is quite a lot of skin material in this as well. So it's possible that there is some psoriasis. Sorry, it's getting a bit wobbly here. Inside her ear canal, but it certainly was very evident just outside her ear, as you'll see when we're coming in and out of the ear. So a lot of those flakes, you'll see them white silvery flakes, will inevitably end up in the ear canal and then possibly cause a blockage, which is what could have happened here. Because I don't think she had too much problem in the other ear with this, but you could see on the outside the psoriasis was probably a little bit worse in this one anyway. But it was a good old plug, as you can see there, having a right good wriggle and jiggle about trying to get this out. That's probably why it's a little bit shaky. Sometimes when you're trying to wriggle like this, trying to keep shake and wriggle with one hand whilst trying to keep the other hand perfectly still while you're recording in the camera, it's not too easy. So sometimes you'll get a little bit of a shake on the other one. And don't forget, these things are magnified massively, so any time a little movement is picked up. But as you can see, quite a bit of this is disappearing up the tube as we're trying to pull it out. And yeah, it's very dry as well. So we've got a good hold of that. Sometimes when you're not moving, it's because you're waiting for the power to increase in the suction tube. Did you see then just the little glimpses of the silvery plaques? Yeah, say for a good analogy I've used before is if you stick your hand over a Hoover attachment, or the Hoover attachment is latched onto something, you'll hear the power in the machine going up. Exactly the same principle with suction machines like these. You get a good grip, get a perfect seal, and the power increases. And that's why sometimes you'll see it's not moving. It's because we're waiting for the power to increase before we can then start pulling. There you go. Can you just see on the side there, these dry, flaky areas? Now, it could be that there is an element of otitis externa in here, which is an infection of the outer ear. That's possible too. But I certainly think the psoriasis is more the problem here. The second ear we've got coming later on. I know there's quite a lot of you like peeling. It's quite a good skin peel in that one, so stay tuned for that one. I know a few of you will enjoy that. And again, you can just see at the base, at the bottom there, these silvery plaques there of this dry, overproduced skin. There we go, got that first little plug out. Hoping that was all of it. It wasn't, but it had pulled this from further back. So we'll just pop that out there. You just got a little glimpse, didn't you, of the eardrum in the distance there. So we cleared the blockage. Yes, there is a little bit smearing at the bottom there. I'm not going to go in fishing after that. It's not going to affect anything. And yeah, this was the other one. So as you can see, it's not quite as dark, this. So it's a bit newer, the skin that's been producing here, which is why it tends to glare off at the camera, as well as the hairs, you know, but all the white skin flakes that you can see there, when you shine the light on it with the camera, it does reflect off it and becomes quite glary, you know. That's unavoidable, that, you know. So just left one little flake there that we're trying to peel away. Just having a little argument with it. Now let's just have a sneak around the corner. There it is. Lovely, clear, shiny eardrum. So they give this lady some advice on creams and ointments and what have you to use to try and manage this, you know. Anyway, this second one here, it's a lovely lady who had a really nasty skin plug in, and as you can see, that's the full-size tube there. It's quite a small ear, and as soon as you put the full-size tube in there, the bulk of the plug, it just straight up. But then you're left with these layers of skin surrounding the ear canal. Excuse me, frog in my throat. Where does that saying come from? I say you got a frog in your throat. I don't understand. Someone let me know. So I've gone down to the fine end tube here, which is a smaller tube, which is usually a lot better. You can get a better grip when it comes to peeling away stuff like this. And as I've said in other videos, you can leave in a little bit of earwax in, absolutely not a problem. But earwax is a combination of dead dry skin and an oily substance. And it's the oily substance that's probably more useful. Obviously, dead skin is no use to you at all. So it's certainly worthwhile trying to peel away a little bit of this. And, you know, I have to be careful when you're peeling away stuff like this, because it can tend to squeak and squeal a lot, which is why sometimes you might see it coming out and then going back in again. You know, the squeaking is, it's called clarinetic. I know a lot of you regulars will know stuff like this, but it's basically the skin which is flapping around violently in the tube while it's still attached, but it's trying to get in the tube, so it flaps, and that creates a squeaking, a squealing noise. Very similar, not dissimilar to how a clarinet works, therefore it's called clarineting. So the reed in the clarinet flaps, that's what makes the noise. So you can see this white skin, dead material there. A nice little peel. Trying to little bit jiggle and see, hopefully it comes away. Got bits, but it's just left this little bit down the side there. And more often than not, as soon as you start a peel, there it takes you all the way back down to the eardrum. So sometimes you think, oh, why did I start this here? Because you've got to keep going. But it wasn't squeaking, and the lady was tolerating it very well. And, you know, it's not going to make too much difference with hearing peeling this away, but it might shave a bit of time off needing to get it done again. So thanks for watching. Hope you've enjoyed these too. And if you like watching these, then let me know. Like I said, I'll try to respond to as many comments as I can. Getting a bit more difficult now because I'm getting a few more comments, but I promise I do read every single one of them. And yeah, if you want to follow the channel, I love getting new followers, new subscribers. And as you can see, this last bit here, just trying to peel it away from the roof of the ear canal there. It's just about to come, hopefully. They are frustrating, these ones, I tell you. There it goes. It's slurped up very nicely, and there's what you all want to see. Nice, clean, shiny eardrum at the end of it. So I hope you enjoyed those too. Take care of yourselves. And for now, I'll see you later. Bye-bye.